Welcome everyone to your COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. I'm Jan-Michele Kearney, and I'm thrilled, of course, that moderating with me is superstar Tropikana from Radio 1. So in honor of Black History Month, the Center for Closing the Health Gap is hosting this special town hall today with Black men in medicine. We have a stellar panel here to answer your questions about COVID and the COVID vaccines and anything else you want to ask them. But first, before we introduce our panelists, we have to give a shout out to our producers and tech team who make it happen, John Reichel and Lauren Harden. They make sure all the tech runs smoothly. They make sure that we get all your questions from Zoom and Facebook. So feel free to start entering your questions into the Q&A on Zoom anytime you're ready. Also the chat on the Health Gap's Facebook Live page. Just as a reminder, we are recording this session so that we can repost it later on COVID-19 communityresources.com and other platforms. So now here is our superstar Tropikana to introduce our stellar panelists.
Hello, how are you doing, Councilmember Jan-Michele Kearney? I'm excited to be talking to these gentlemen today, and I'm sorry that I don't mess up their names. I'm sure that I will one though.
I can't hear anything.
I think Tropikana's volume needs to be up just a little bit, tech team.
Can you hear me? Am I clear, coming in loud and clear?
You sound way far away, but I think we can hear you.
Okay, well, I'll just try to scoot a little closer to the camera until we can get it fixed.
Okay.
I can't hear.
Dr.
Hello.
Dr. Clyde Henderson.
This mic, we can hear you on the live stream. So you need to mute your phone.
But I can't.
Okay, we're
can't.
fixing it all.
I can't hear you.
Tropikana, you want me to just introduce, so Dr. Crawford, if you could just mute for a minute while you're working that out. And Tropikana, let me just introduce everybody while they're getting your tech together, okay? So doctors, we've got Dr. Alvin Crawford, Dr. Clyde Henderson, Dr. Michael Thomas, Dr. Lester Duplechan, Dr. Basil Williams, and Dr. Conrad Cole. Okay, are we ready with Tropikana now? Let's do this. why don't we do this? Each of our doctors, and we'll start with Dr. Alvin Crawford. If you're not unmuted, please unmute now and just give us a few words as an introduction. Just 1 or 2 minutes, a quick intro, and then we're going to get right to the questions.
I think Dr. Crawford is still having some technical difficulties.
I log in and out and it's not working.
Yeah, he can't hear us, but he
can't hear us. Okay, well,
yeah,
Dr. Crawford, we're going to come back to you. Okay, let's start with Dr. Clyde Henderson.
Good afternoon.
Good afternoon, Dr. Henderson.
Thanks for the invitation to participate in this town hall again. Even though I retired about 3 years ago from active practice, the onset of this COVID-19 virus urged me to participate in service. I'm elated to be here with this august group of African-American physicians from all different specialties. Our mission as representing Black men in medicine in Cincinnati is to improve the healthcare outcomes of our community by pushing to increase the number of African-American men in medicine. No healthcare catastrophe better than this COVID-19 pandemic can bring home the absolute need for people taking care of our community to look like our community. We are here not only to help the fight against COVID-19 now, we're also here to try and get more Black men in medicine in order to have more folks available to fight the next one.
Wonderful. Thank you so much for those intro words, and we'll be back to talk more. Okay, next, let's see, Dr. Michael Thomas.
Thank you. I appreciate you allowing us to come on and to talk about the need to make sure that the COVID vaccine is accepted more so by our African-American community, and to talk people into, to talk about the safety associated with taking the vaccine, but also our job is going to be today to talk about trying to get more African-American men into the medical field. Unfortunately, there's been a significant decrease in the number of African-American men in medicine, which correlates with, unfortunately, the inability to treat patients the way they need to be treated and to have these conversations more frankly with patients that where patients may feel a little bit more comfortable. So as we go through this next hour, hopefully we continue to touch on all those topics.
That's great. Thank you so much. Dr. Duplechan.
Good afternoon, and thank you for the invitation. I want to thank all of you who are listening, watching. Hopefully you learned something from this and you can talk to people in the community. I'm originally from Los Angeles. I have a French last name because my parents are from Louisiana, but I'm from Los Angeles. I went to UCLA School of Medicine, but I was in the Charles Drew program, which was a springboard medical school that was started out of the Watts Rebellion. And what was found during the McCune Commission was that there just wasn't enough healthcare for the people in the city. And so our mission at Charles Drew was to provide medical care to the underserved communities with compassion and with competence. And so it doesn't matter where you are in the world, that mission goes with you. And that's why we're here today. We want to make sure that we are taking care of our community.
That's wonderful. And, one of the topics we really want to cover today is why Black men in medicine is so important. And of course, Black women in medicine as well. So thank you for that. And I think I said your name wrong. It's Duplechan. Okay. All right. We're gonna get it right. Okay. Tropikana is praying for us. She said, we're going to pray that we get it right. So we're going to work on this. Okay. Next, Dr. Basil Williams.
Hey everyone, I'd like to thank you for the warm welcome and opportunity to speak with you all today. Looking forward to answering some questions, and I think Dr. Henderson, Dr. Thomas, and Dr. Duplechan have done a wonderful job explaining why we're here, talking about increasing the numbers of Black men in medicine, talking about the COVID-19 vaccine, and so I'm excited to participate. As a little bit of a background, I was born in Grenada. I grew up in the Bronx, New York. I've lived pretty much everywhere in the country, almost every major city, and I'm somewhat new to Cincinnati, and I'm excited to be part of the community and to speak with you all today. Thanks so much.
Well, we're so glad you're here. Thank you so much. Okay, Dr. Conrad Cole, who I think was the first guest on today.
Yeah.
Thanks, Dr. Cole.
Yeah, thank you very much. I'm Conrad Cole. I'm a pediatric gastroenterologist working out of Cincinnati Children's Hospital. And I'm probably, I think I'm the only pediatrician. Well, Dr. Crawford is a honored pediatrician as he spent most of his career at Cincinnati Children's. And I've been at Cincinnati for almost 20 years, in and out of the city. I did my training here and came back after a few years at the CDC. And really, as an epidemiologist, this is really key that we address this from the grassroots up, getting people to know what it means. And like everyone else on the panel here, I think our goal is to reach out to the community that looks like us, not only like us, but the entire community, so that we can get people vaccinated.
And that's wonderful that you're a pediatrician, because I know, like Tropikana has a young son. Many of our listeners have children. And so people, I have a 16-year-old, I have a 23-year-old, but also a 16-year-old. And so we're wondering, if and when our children get that vaccine as well, get the COVID vaccine. So we're going to come back and talk about that. Okay, Dr. Crawford, are you on? Are you ready? Okay, well, we see you. We don't hear, you know what? You have to unmute. Unmute, and let's see if we can hear you. There you go. Okay, a few words of intro, and then Tropikana is going to start us off with some questions. Dr. Crawford, go right ahead.
I think he's still having some technical difficulties. Again, we can hear him, but he can't hear us still.
Okay. So I'll ask our tech team if they could please just let us know when Dr. Crawford is ready and he will have to unmute. All right, Tropikana, are you ready to go to some questions? And audience, feel free, Facebook. We already have a few that we're going to start with, and Zoom. So go ahead and get your questions in, and let's talk to these Black men in medicine.
So excited to be celebrating Black men in medicine today on our town hall. Thank you guys for your service and your choice to help us in the community. Our first question is to Dr. Crawford. Tell us about Black men in medicine and why you started it. Is his mic still muted?
Yes, his mic is muted. Could someone could someone unmute him? Tech team, there we
Okay.
go.
I'm talking to him.
There you go.
Yes,
Dr.
we
Crawford.
started about a year and a half ago. And the most important thing is I'd like to thank you for allowing us to be on. This is the first exposure to Black men in white coats. It's under some difficult conditions. But, and this is, as opposed to Black men in white coats, this is Black Men in Medicine, Cincinnati. And it started because of a feeling of concern of the diminishing number of African-American males in medicine. It hasn't increased since 1978. And I felt that because of this, we should do what we could to recruit, to sustain, and to get African-American males to graduate. We've done several things. It's one of those, you can't be what you can't see, and having them to come with us and mentoring, it's sort of like a dating service that we connect the medical student with a practicing physician. They get to know each other, they have the memories. And the last thing is that it's been proven this helps the academic level. Even though it's not rateable on tests, they tend to do better, and they have mentoring, they have motivation, and they have memories, which is if they're connecting to their mentor. Thank you for having us on.
That's fantastic. And so, so my follow-up question for that is, I know that young people have to start, way before college thinking about medicine. I think they do. So you tell me, is that something that Black Men in White Coats is working on, like reaching maybe the high school kids?
That's first of all, it's Black Men in Medicine, Cincinnati. Black Men in White Coats is another organization.
Group. Okay.
I'm the antithetical person that you're speaking to. I made it in music in college. I never thought about being a physician until the end of my sophomore year. So, I mean, like never ever. And it was taking up a challenge from my big brother. That's well documented.
That's amazing. And then you ended up being this international orthopedic surgeon. I don't know if everybody knows, your history, but, you had, some of the royal families in other parts of the world flying you over to do surgery on their children, and you headed up orthopedic surgery at our Cincinnati Children's Hospital. I mean, your legacy is huge. And, if you're telling me you didn't even think about medicine until you were a sophomore in college, look what the world would have missed.
Well, I don't know whether they're missing a famous musician today.
Well, we've heard you play. You're really good. It's true. You're really good. But I think, I don't know, life-saving surgery. I'm thinking, but yeah, it's all important. Yes.
I've been very fortunate in things, and very fortunate to be able to attract the young men that you have on your screen now, because they are members of Black Men in Medicine Cincinnati, and they will be showing their stuff to the town hall today, and that's all I could ask for. I won't be necessarily a participant, but I'll get the word. Thank you very much again for having us on. We really appreciate it. And we would probably be delighted to return when the sound is better.
Yes, we're doing okay now, I think. I think everybody can hear. So I think we've got all the little glitches worked out. Okay, Tropikana, take it away.
Right, let's get to our next question. And this is for all of our gentlemen on our panel today. I would like to ask you, how do you each feel about the COVID-19 vaccine? Starting with Dr. Conrad Cole.
It's a move in the right direction. That's what I would like everyone to understand, that, in order to get this pandemic under control, one of the things that we have in our armamentarium is vaccination. So we've got all of the other measures. with regards to, social distancing and isolation and washing hands and making sure that we do the right thing. But I think that in order to get it appropriately controlled, we need to have some form of vaccination. And the science is there, it's proven. I believe all of us who are here have been vaccinated. Either, we probably have completed it. I know one of the members here was involved in the trials as well. And we yeah, and we're all excited that we've got this, we're matching towards getting it under control. So that's the way I feel about it. I'm ecstatic, excited that it's available.
Okay, and I know everybody else is going to answer too, but Dr. Cole, since we've got you on this question, when is it going to be available for children? I mean, when do you think your patients might get to have this vaccine?
So some of my patients who are, one of the vaccines is available for patients from 16 up, the other 18 up, and I see patients up to the age of 26. So some of my patients do have the opportunity to have it. There are trials now going, down to the age of 12 for both of those companies. And we're hopeful that in the next couple of months, we'll have enough data to prove its safety and efficacy in those groups. So the answer to that is probably by the end of the summer, the kids will be vaccinated.
So are the Moderna and Pfizer companies having trials with children, or is that Johnson & Johnson? Who's doing the?
All of that above. I know that Moderna and AstraZeneca and Pfizer, actually those three companies I'm aware, they have trials for kids all the way down to the age of 12.
Okay, all right. And so we should know by the summer whether or not it's safe, and we're thinking it's going to be safe.
Yes.
So far, okay. And then I know later Dr. Thomas is going to share his experience being in the trial. But Tropikana was asking everybody, how does everyone feel about the vaccines? So, please unmute and just go ahead and let us know. Dr. Henderson?
I've been blessed to have had both of my vaccinations. I had the Moderna and had a little arm soreness after each one. It lasted for 12, 18 hours. I was able to work out the next day. And I'm just excited about having had the vaccination. They're safe and effective, but we still have to mask, still have to socially distance, and we have to still wash our hands and avoid crowds. But I'm just looking forward to the time when I can start to hug my grandbabies again. And
That's right.
and so with the vaccine, that's the ticket. It's just going to take a little time for everybody to get vaccinated.
And Dr. Henderson, can you just follow up and tell us why do you still have to mask up and social distance? You've been vaccinated. Aren't you good to go?
Yeah, the vaccinate. They have not proven yet that you can't still be contagious. You can get the virus in your nasal passages, and you can possibly still spread it to other people, even though you won't become sick. So there's still work going that's ongoing. That's starting to indicate that we'll be able to take off our masks, but that's not clearly proven as of yet. So at this point, it's not known well enough for us to just take the mask off. So we still need to keep them on because we may still be infectious to other people, even though we won't get sick if we're not likely to get sick if we've taken the vaccinations.
Okay, all right. Thank you for clarifying that.
Mm-hmm.
Okay, who's next? Tropikana is still asking everybody, how do you feel about these vaccines? And we just heard about Johnson & Johnson, so now we've got Moderna, Pfizer, I guess Johnson & Johnson, which is only 1 dose versus 2. AstraZeneca, has that one been approved for us yet? I haven't heard. Okay, so we're still waiting for that one. Okay, so we've got 3 available now, right?
So,
okay.
I can hop in and answer that question next. I was really excited to be able to get the vaccine. Was really impressed with the country moving very quickly as a whole and the demonstration of science to put these vaccines out in record time, still going through the appropriate safety measures and making sure that they were efficacious. And I knew that as a fairly young person without any comorbidities, I had some level of guilt getting the vaccine very early on. I knew it was a blessing to be able to participate in it, and it was something that I definitely wanted to do to try to reduce the risk to my patients, as I'm seeing a lot of people on a regular basis, especially people who are a little bit older. And as I'm an ophthalmologist, but I do a lot of ocular oncology. Many of my patients also have an underlying cancer diagnosis, and so they're at a little bit higher risk as well of having significant effects from COVID. So I was grateful to be able to get both doses of the Moderna vaccine, and I feel great about it to reduce that risk for those patients. And as everyone has mentioned already, still trying to be responsible, making sure to wear a mask and socially distance until we have enough people vaccinated that we're in a better situation.
Okay, great. Thank you so much. Okay. Dr. Thomas, he was actually our guinea pig, right? I mean, you were in the trial. You're still in the trial.
Yes, I'm still in the trial. I'm obligated for 2 years. I thought it was very important, and I have Dr. Crawford so he can hear us. I felt back in the early fall that it was important for me to get in because I thought that they needed African American, especially African American men who were a little older in the trial, and I thought it was important that I be one of those people because, you know, in order to be able to talk the talk, and I didn't know what I was going to get. Luckily, I did get the vaccine. I got my first one in October and my second one in November, so about 2 months before they really started coming out. And I had very few side effects, and the side effect profile isn't as bad, particularly as you get older. You know, some sore arm, but it was important to me to get involved just because it was going to allow me, like now, to come and tell people how important it is. And as I have said, as other people have said, I may die of a lot of things, but one of them won't be COVID. And the nice thing about the mRNA vaccine, the one thing that people don't understand, they've been testing mRNA vaccines for a long time. They just hadn't been testing them in humans yet. There wasn't the opportunity to. So when this opportunity came up, and one of the advantages is that it's only in your system. It's just training your body to basically get rid of the spiked protein, and then it gets out of your system. It's just allowing your body to sort of train itself to get rid of these spike proteins. And I'm sure we're going to probably start using mRNAs vaccines more commonly because there are very few side effects and it has a long-term positive implications.
Okay. Tropikana? Tropikana had a follow-up.
Follow up to what you were saying about the vaccine. We have a member here joining us, Latanya. She wants to know, and thank you, Dr. Basil, for answering her question in the chat. Latanya wants to know, do any of the vaccines prevent transmission? And have all of the panelists received the Moderna? And is the Moderna preferred over the others?
I can answer this one. I don't want us to get too stuck on brand names and which vaccine is which. They've all been found to be safe and effective. If you have the opportunity to get vaccinated, please get vaccinated. I wouldn't have cared if it was called Joe's vaccine. It's a blessing that as a community that we have the opportunity. I don't know if you guys remember, but early on when they were starting to vaccinate people, a rich family flew up to like Alaska or something and got in line first in order to get the vaccine and kind of cut the line. And so you can tell that this is very important. You know, with all of our people in Congress, no matter which side of the aisle they were on, they rolled up their sleeves and they were the first people to get them. So it's very important. So if you have the opportunity, please get it. They're all about the same as far as efficacy. They're all safe. You know, I'm a rehabilitation physician, so I'm seeing the survivors. And one thing to understand is, even though you may know people who've had it and stayed at home and got a little bit sick like the flu, there's still a lot of people that are still in the hospital from November and December, and they're still struggling. And this is almost like polio, where we're going to have people who are going to have impairments for the rest of their lives as a result of having this infection. So we want people to survive, but we also want to get rid of the morbidity of it. We don't want people to be impaired because maybe they didn't mask up, or they went to a super spreader, or they decided, well, I think this is some sort of government experiment. I don't think this is not Tuskegee. I don't think this is a way of trying to get rid of Black people. I think that we need to step up and try to protect ourselves.
That's right, because COVID's trying to get rid of Black people. So we want to make sure we fight COVID. Here's a question from Facebook. So, and we're going back to talking about Black doctors, so Black men in medicine. And so the question is, what percentage of doctors are Black men and what percentage are Black women? Does anyone have numbers?
There's a much higher incidence, better still, percentage of Black women. It's an interesting phenomenon. The percentage of Black women since '86 has increased probably 60 or 70%, whereas the number of Black men have decreased. And it's multifaceted as to how that has come about. So as a result of that, then the number of African-American men in medicine is significantly low. And it's less than the 3 to 5% that we consider physicians who are of color in the United States related to the population anyway. So we think it's very, very important. There are studies now that show that a middle-aged African-American man is more compliant, is more trusting, it gets a better result. As a matter of fact, a cardiology study out of Oakland showed that there was a 19% increase in longevity in living if they had a physician, an African-American physician, someone who looked like them, that they could put their basic trust in, and it worked. And so we feel that that's real, and we're trying to.
Huge. Are you kidding? Wow, that's big. A 19% increase in longevity because they had an African physician?
Absolutely. They did a study. It's not double-blinded, but it's out of Oakland, California, where they had African-American physicians to take care of a population, and they had non-African-Americans, and noted the difference in the recovery. And they actually stated it's more than likely a trust. It's sort of like equity, that you can say something to an African-American, can say something to an African-American physician, and they know that they're hearing them, not just listening to them. And there is a difference. And so they feel more comfortable. They also feel for procedures that are not life-threatening, for elective procedures, they're much more, they have this feeling that might be from old, that quote unquote, they're going to be experimented on, or they've got insurance and a doctor's operating them. But it's just it's a combination of equity and trust. And so we'd like to improve that and increase that by having more African-American men in the field.
Well,
you also have to understand
medicine. I'm sorry, Dr. Thomas, go right ahead.
I said it's more that you have to understand. It's like when I go through the Kenwood Mall and I see an African American person, I'm always going to acknowledge it. I'm always going to say something, put my hat, say something to
Dr. Thomas, I think you've got two different.
I have this on mute now. So hopefully.
Okay. All right. Start all over. What did you say?
I said it's like walking through the Kenwood Mall and acknowledging a Black person when you are walking through the mall. These are the types of things people just sort of feel more comfortable. It's just that sort of acknowledgement. And I will tell you, in talking about trying to increase the number, one of the things that we're doing at the
you can do that.
Health are things like trying to increase the pipeline, not just going to the high schools and the colleges and looking at and trying to find the Black students that are interested in the sciences. But now I know I'm going back to my old junior high in the Chicago area and taking simulators and trying to help them understand that medicine is a future for them, for their career choices.
Oh, that's wonderful. I love that. That's wonderful. Now, Tropikana, we always like to dispel the myths. It's what we do at, every town hall meeting. Tropikana has a list of some forwarded from a young Black male listener this morning. Tropikana, let's ask the doctors about these myths. Go right ahead.
This was a big list. We wanted to understand what is the purpose of getting vaccinated if these are things that I still can and cannot do. There's a list of things. I'll just read a few of them and you guys can address them as you feel free to wish. It says, remind me again, what is the purpose of vaccinated against COVID-19 if these statements are true? Can I stop wearing a mask? No. Can they reopen businesses? No. Will I be resistant to COVID? No. At least I won't be contagious to others. I'll still be able to transmit the virus. What is the purpose of getting vaccinated if these things are still true? Can you guys kind of speak to some of those?
You still need to wear a mask, yes. Businesses will eventually reopen, and it's going to be a stepping stone. And the stepping stone to getting businesses reopened is knocking down the level of the virus in our community. So, even though all the business can't open fully now, they will start to slowly reopen. You still need to wear the mask, and the purpose of getting the vaccination is so that you won't get hospitalized and die from COVID-19. You will probably be less likely to spread the virus, although it's not proven as of yet after you've had the vaccination. This is this has only been with us for about a year, so we're still learning a lot of. It's very important that you still get vaccinated, even though you can't do everything that we did a year and a half ago yet.
Okay. And so, you know what, so let's pivot back for a minute back to Black men in medicine, because we have questions. Actually, just so people aren't getting confused, we have questions coming in about Black men in medicine and questions coming in about COVID. So we're going to go back and forth so we can answer everybody's questions. But here's the question. So we're back to medicine, and I'm going to put these two questions together. One is, how much education is needed to become a doctor? And that's always a big thing with young people. Like, how long, do you have to be in med school forever? Like, do you have to be in school forever? So talk about that. And also the other question that goes with that, is there a medical specialty in which Black physicians are more prevalent? Two really good questions. So anybody can answer that.
Can you hear me?
Yes.
Well, yes, it's a fairly arduous course. That is getting into medical school. And one has to, most often they're very, very motivated students, in that they know early on when they want to go into medicine that it's going to take a good transcript. They've got to have lots of knowledge, and they have to be communicative. And as a result of that, I think we would say that most of the kids are. Most often it's required not necessarily a degree, but that one has the prerequisites. There are prerequisites that have to do with a science curriculum that it requires to get into medical school, and what's called an MCAT, which is a medical college aptitude test. And when one passes that, that is the academic requirement. It's like anything else. It doesn't matter where you get these, but you do have to test and perform to show that you have these qualifications prior to being admitted. And it has nothing to do with you don't have to go to a four-year college. Some will admit you early. There are lots of programs now. There's a medical science program at the University of Cincinnati where they actually major in medical sciences. Whether that'll give them a leg up, I'm not sure. But there's a University of Michigan that has a course that's designed, it's a flex course that will allow you to start off and have a 3-year undergraduate and a 4-year medical. And then a lot of the Europeans and other countries will have it. So it's about 6 years after you graduate high school. So it's a variable.
That's good to know. Doctor, and I know, Dr. Basil Williams, you're about to say something, and then I was going to ask Dr. Thomas, what are some of the issues that his junior high students bring up? But Dr. Williams, go right ahead.
Yeah, I was just going to say really quickly to the second part of the question in terms of what fields of medicine Black men are in. You have a wide range here on this town hall right now, representing OB-GYN, pediatrics, orthopedics, rehabilitation, and ophthalmology. So all fields of medicine are open to Black men, and we really have to work hard to increase those numbers in all areas. And that's what we're focusing on, not only to just increase the numbers of Black men, but we know that it improves patient care, as Dr. Crawford was mentioning with the Oakland study. It also increases the number of Black people that are in decision-making positions for how healthcare is delivered. And that changes the thought process to make sure all people are included as well. So it's something that we're really pushing for in all specialties.
That's great. That's wonderful. Dr. Thomas, do you want to, what are some of your junior high students concerned about?
Yeah, I grew up in this town called Robbins, Illinois, which is just south of Chicago. It's an all-Black town that started after the 1900 exposition out there. And the kids don't always get the opportunity to think about, just like in many of our other inner city schools, to think about medicine or even the sciences as a career option. And it's just so important that these kids see someone like myself and then bring in these surgical simulators, and we see all the kids from 6th grade, 7th grade, 8th grade. I stay there all day until the last kid gets a chance to pretend like they're doing surgery on the same simulators that they use for training physicians. There are only 3 in the country, and we take 2 of them to Robbins, Illinois. And what we do during that time is that every kid gets a chance. Kids who are even in the remedial classes get a chance, and they come away from that saying, well, if he could do it, I can become a doctor. That's one. And they're very, very vocal about that. But the fact that they are very competitive and they get a score at the end of their chance at working on these simulators. And they always work to get the highest score, and they get timed and everything. And my son even used these simulators when he was at Walnut Hills for his science project. So it's very important to get these kids interested. We always talk about college and high school, but it's really even sooner than that, especially for our African-American kids of color. Just try to get them, to let them know. So there are a lot of these kids who I helped teach during that time who are now pre-med or pre-nursing or pre-pharmacy. So you're trying to make a difference early on.
That's fantastic. That is wonderful.
Dr. Thomas and Dr. Crawford, I'd like to ask you a question in that same lane. You guys are focusing on young kids, and it's so important with such a long-term commitment to education. You start early. But what about some of the millennials who did not get an opportunity to see Black doctors early on in life? When they followed another, they wanted to be a radio personality. Is it too late in life to decide that you want to explore a future in medicine? Would you encourage people who might want to do a career change and they've always been interested in medicine to do so?
I think you have to follow your passion. And if your passion hits you later in life, then that's when you do it. There was a retired auto mechanic who was about a year or so ago. He was in several of the medical journals, where he decided after he retired that he wanted to go into medicine. There are a lot of people who are in the military who retired at an early age who want to do medicine, and they get the prerequisites and they go in. And they are some of the most motivated individuals that you would see because they have a focus and a purpose. And for the millenniums, that's an unusual group, but the same thing pertains to them, that they can do it. It's again, follow your passion and your dreams, and you can get it done.
You know, I just like to also say I was a film major in college. I was a television film major, worked in television in Chicago while I was getting my degree at Northwestern. And I know Miss Mahaffey Harris's daughter is also at Northwestern, and Northwestern really encourages that and. So you can be a pre-med and a radio, TV, film major. I was lucky to be able to do both, and I could have gone either way, got accepted to medical school on the same day. I got accepted to a master's in fine arts program in television production at UCLA. And I hope I made the right choice, but I'm here right now and I'm running things at University of Cincinnati, and I am doing what I need to do because, you know, my brother was on different worlds, so he's now teaching. So things sort of happen and change over time, but I was very lucky to start in a different way and was a non-science major.
And I think about all the babies that would not have been born if you hadn't been here with your fertility treatments and your expertise. So No offense to the fine arts field, but I'm really glad you chose medicine. So thank you for that.
I wanted to quickly go back to our question about how long does it take? And I think too often young people look at this long road and quickly decide it's not something they want to do. And I think what we need to be telling young people is that we're all lifetime learners. We want to be lifelong learners. We don't want to just get to the finish line. And what I usually tell young people is, what's the point of studying something you don't like and then working a job the rest of your life that you don't like? It's better for you to stick with it. Getting a lot of feedback.
Dr. Duplechan, hold on one second. So if anyone has like two different things, plugged in or open on Zoom, one of them needs to be muted. Like if you have your phone and the computer, please just mute one. I think that's why we're getting that feedback. Just want to make sure we can hear everybody. Okay, I'm sorry, go right ahead.
Oh, no problem. So it's best to love what you're doing. And if it's medicine, go for it. I had two people in my first year class who were 42 years old and had completely different careers. And what medical students figured out, like in the 70s and 80s, was the best doctors were not the people who got to medical school first, who were 20 years old, 21 years old. The best people were the people who had lived a little bit of life, who could relate to many different people, folks who had traveled and spoke different languages. And so medical schools are looking for that right now. So, and all of us here on this panel and all of you, everybody continues to better themselves throughout their lives. We all have the growth mindset. So it's not finishing medical school and then you don't have to read anymore. We're all still reading, we're all still trying. I feel I'm better now than I was 10 years ago. And we all should feel that way. So I think if we tell our young people, this is lifelong learning, and it doesn't matter when you get your degree, what matters is that you're doing what you love. And so we want to encourage young people to go for it. They can do it if they get the opportunity. I think all of us have a story here that we could tell about the bumps in the road and how difficult it was and how many people told us no and how many people looked past us because they were looking at other people. But if we can do it, anybody can do it.
That's fantastic, very encouraging. And someone put in the chat that I failed to mention that Dr. Thomas is the first Black department head of OB-GYN at UC Health. So we want to, Dr. Thomas, give you your props. Okay, so Tropikana, we have all these questions popping up. We're going to have to, time is flying. We've got a lot of questions popping up about COVID. So do you want to take some of those? We've got Willis Shelby, Kelly Prather, Latanya. I mean, lots of folks, they're coming at us. So let's go.
Get it. She says, are there specific diagnoses or pre-existing conditions that you are aware of where patients should not receive the vaccine? Anyone who would like to answer?
I could tell you that's a very good question. There was this talk that for the majority of people that there aren't that many contraindications or inabilities to not take the vaccine. I misunderstood a lady once on a television show and said autoimmune disease, and that's not true. Autoimmune patients can take it. Patients with possible very severe allergies probably need to talk to their physician about the vaccine before they take the vaccine. If you have very severe allergies, just to make sure you can take it. But there's some studies to show that even those patients can take it. Patients who are pregnant, there's studies, even though they weren't in the original studies, patients who are pregnant, we're advocating that it's safe to take the vaccine. And the vaccine, when I put on my other hat, my fertility doctor hat, the vaccine will not cause a fertility problem. So pregnant patients, patients who are seeking fertility issues, and patients with allergies. The allergy patients probably need to see their physician first, but it's even thought to be safe in those patients and they need to be monitored.
All right.
Yeah, I think my advice to everyone is that if you're worried, speak to your physician. That is actually the advice that I would give. If you have a chronic condition, speak to your physician. I mean, we are recruiting, we're encouraging all of our patients, developmentally delayed patients, all of our patients with chronic liver disease, transplant patients who already are on some form of immunosuppression to get vaccinated. Those that meet criteria, and we're actively doing that right now. So that would be my advice, that if you have a question, please have a talk with your physician or someone you trust.
All right, that's great news. That's good advice. And I should say, if anyone says, hey, I don't have a doctor, Dr. Melba Moore is telling you, you've got the Cincinnati Health Clinics. There are 7 of them, if I have that number right. And so she said, we want to be your primary care physician if you don't have one. So, okay, here's another question. This one is, this is from, I was looking for the one from Willis Shelby because I just passed it up, but she was asking about interactions of medicine with the vaccine. Like, have the interactions been studied? She said she's not hearing a lot about that.
Dr. Williams, can you address that for us?
Yeah, sure, absolutely. So in the clinical trials, they are looking at all of those factors. So what underlying medications people are on and things like that. There does not seem to be any concerning interactions that we know of at this point, but we will still continue assessing that in the trials for the years to come. So that does not seem to be something at the moment that is a major concern. And I think that's why you're not hearing a lot about it, because there do not seem to be a lot of interactions that are concerning.
We have another question from Kelly Prather that Dr. Williams, you also answered. If you would not mind, could we just kind of readdress that one as well? She said she has a Black male patient disorder. His case manager discouraged him from taking the vaccine because the formula supposedly includes fish eggs. Is this accurate? And is it safe for this patient to take the vaccine?
So I think first, Dr. Cole kind of highlighted this already. Whenever there's any doubt or any concern, everyone should speak to their individual physician to make sure that they are able to discuss their situation, because things might be different per person. The flu vaccine does have some involvement with eggs, but as far as the COVID vaccines that are available, there does not seem to be, there's not any use of eggs at all. So this allergy does not likely seem like it should be an issue. But again, speak to your individual physician just to make sure.
Good to know.
Dr. Thomas or Dr. D, either. One of the questions that I hear a lot from Black men is that it's been only a year. Dr. Henderson, I believe you said that earlier. Only a year that they've been working on it. It feels really rushed.
Tropikana, you might have 2 things going too. I'm not sure.
And I'm not sure what that is. That's not me though.
That's not, okay, I'm sorry.
He said they would like to know, what would your response be for people who feel like the vaccine was rushed, or that they should wait a little while, or even when it's their term, should they wait till next year to get it to see what everyone else's side effects are? Can you speak to that?
Dr. Duplechan, do you want to start?
Yeah, I think what I would tell that person is that we're forgetting not just the people who've been infected, but the people who passed away. And you think about it, we've lost 500,000 people. And many of these people didn't have the opportunity to get a vaccine. We're finding out that a lot of people who died of other disorders, it was really early COVID, and they just didn't have a chance. And you know, colored communities, especially in New York, really got hit hard. So those people didn't have a chance. And I think if you spoke to their families, they would probably not have any problem. They certainly wouldn't want to wait. And so it's hard for us to think about what 500,000 people looks like. You know, we can't just think of a stadium or a city, but I think of things in money. And I think about it like this. If I told you that I was going to take a dime out of your account every day, you'd probably say not a big deal. But if I told you I'm going to take 500,000 dimes or $50,000, you'd say, hey, wait a minute. But we lost that many people. And so I don't think we have the ability to sit back and wait to see what the side effects may be, because the side effects so far are not death. And they don't seem to be the disability and the impairment that people are having who are even surviving with COVID. So I again, speak to your physician. Get off of the bulletin boards. We've learned that a lot of the stuff on there isn't written by people who are in science, but ask your physician. If you don't have a physician, please get a physician. But I think that's somebody who works for you, somebody who wants you to do well is probably going to give you the best advice.
Thank you.
And following up on that, I was going to say, Easy Connect said, is there a Black physicians group? How can I find a Black doctor?
There is.
I could answer that.
Cincinnati Medical Association.
Yeah, the Cincinnati Medical Association, and UC Health has a number of large number of Black physicians, and you just go to the uchealth.com website and you can kind of scroll through and see the internal medicine doctors or anything else. But Cincinnati Medical Association is one of the best ways of finding it out. Just Google Cincinnati Medical Association.
Right, that is our organization of Black doctors in Cincinnati. And are you affiliated with the National Medical Association?
Yes.
I'm affiliated with everybody. I think all these other people are too. We are trying to make sure that we support these organizations and that we are all affiliated with these organizations. It's so important to let people know that that we are all a part and are joined together.
Okay, so someone else. Oh, I'm sorry. Let me just ask this quick question. The Tropikana, okay. I'm going to turn it over to you. So someone said, I've heard over the years that Black men do not get annual checkups as often as other groups. Is that true?
And if so, why?
Yes. What's happening, Black men? Come on.
I think in the community, sometimes at a certain age, you grow up with sort of a, I don't know whether it's a fear of doctors, but you're just not interested in the health industry. And that becomes almost colloquial. And I think as we age and we have more experiences, that will disappear. But I do know that I'm from Tennessee, I'm from the South. I can say that it's sort of like, where, he never went to a doctor and then he went and a week later he died. Well, he had a chronic cancer. He was never diagnosed. So I think that's an important thing to know for that respect. Can I ask you a question for the panel? In my research, I noticed that it was stated for some women who are being followed for breast cancer, that if they're having their studies done, sometimes the inflammatory response of the vaccines to the virus will cause them to have an increase in inflammatory changes in their axillary region, and it can obscure some of their studies. Is there any information that anyone on the panel knows about that?
I do not, but I would assume that would be more short term.
It is.
Yeah, I would think not. And getting back to the male issue, when I put on my fertility hat, asking men to give a sperm sample is like asking them to give them an ATM card. They would not want to go into that little room. And it's just hard to get men, and Black men in general, to do that. So I will tell you that it is a problem that we have, and it's something that we need to overcome, but it's something that we need to discuss.
What's even worse is that trying to get a Black man to go in for a prostate check. That's very difficult as well. And there's a lot of that mistrust that people are feeling from the COVID vaccine. That's the sort of thing that has gotten us into some of the issues with the healthcare disparities that we're dealing with. And we're trying to overcome those.
And, prostate cancer, it can be caught early and it's really treatable, right? A lot of the cancers, if we catch them early, they're treatable and the recovery rate is great. I know for women with breast cancer, that's also true. But I hear prostate cancer is really treatable. We have to make sure our babies are early. Dr. Crawford, are you weighing in on that, on the prostate cancer?
Yes, what I think is that it has to do with the messenger. And sometimes the messenger and all the ads are people who don't look like them. I think this is why Black men in medicine will be very, very positive. As more Black men come into the field, you get to know them, people gain respect for them. Then the camaraderie, not only the camaraderie, but again, the trust issue comes back. And then it resonates much, much more. So I think that would be my goal in life, to get us as African-American men to have more of an audience with African-American male physicians. And I think that it will change things as time goes along.
That's excellent. Seeing you guys on the panel is really encouraging. And I love the fact that someone asked that question about how do they find a Black doctor. So that's, we're moving in the right direction.
Now, I do want to ask you guys this. One of the things that I have noticed, again, just with the age group of people that I encountered today and I work with, 18 to 34, Black men have a prior, I don't want to call it a priority issue, but there are so many things that they have that they feel are more pertinent than their health, bills, stress, kids, things like that, where they put their health in the rear. It's not the first thing on the top of their mind. And most of them also feel like they're invincible. I'm not sick. I don't feel sick. I feel young. I can jump over a wall. At 18, I was invincible as well, too. Can you guys speak to the young Black men who feel like they are invincible or that other things are more important in the moment than their health?
They should prioritize themselves, and that they may have all these other problems, but if you have a significant health problem, that may be the last problem you'll ever have.
Mm.
You know, it's almost another show, but I think when I was growing up in Los Angeles and when I was at King Drew Medical Center, many of these young men didn't think they were going to live to be 20. So when you talk to them about, hey, you have to think about how you're eating and possibility of hypertension and genetic things, they're like, why should I everybody else is in jail or whatever. So, you know, we have to have another way of looking at this. And I think the other side is there's still a lot of implicit bias in medicine. You know, we mentioned that Dr. Thomas is the first chair of OBGYN, but let's be real, he's the first chair at UC of any department. So let that sink in for a minute. The first Black chair of any department. And so even though more Black women and Black men and people of color are getting into medical schools, we're not in those positions of dean and chair. And the same with women. There's very few women chairs of departments and deans of medical schools. And so I think as we've had more people of color go through medical school, the system thought that would fix all of our disparities. But the reality is the same people are making the decisions. And they just thought putting more doctors out there would fix the problem. And COVID is a perfect example of that. So part of Black men in medicine, we want more Black women doctors too, don't get us wrong. But Black women doctors continue to increase in number, but Black men doctors peaked in the 80s. It's going down. So we really want doctors who can relate to men, to young men and say, hey, you are valuable, we want you here, and we want you to take care of yourself.
And I just wanted to add to that, the decisions in healthcare aren't being made necessarily in the office. The decisions in healthcare are being made in private, in rooms where people are making decisions for you and about you. And that's the advantage of being in the position I'm in right now. I am in the room, but I'm cracking that door for other people, because in order for there to be more like me, I have to do the right thing and stay focused. And I have to be able to say, this guy should be on a committee, this guy should be on a committee, and we need to continue to have those conversations and not minimize the Black community when it comes to decision making.
Thank you so much. Okay, so we're almost at the end, but there's a question for Dr. Basil Williams. So if you could tell us real quickly, how did you get interested in medicine?
Yeah, so that's a really long story that I went through undergrad, and I played basketball, and I played basketball in Europe, and that was actually my focus. And then as I realized I wasn't good enough to play in the NBA, I came back to the States. And while I was putting together my my resume for a job in finance, I worked for a doctor, and that really changed my whole viewpoint on what I wanted to do with my life and why. I saw the interaction that the doctor had with the patients. I saw how he was able to impact the family structure. They were having conversations not just about their eye health, but they were talking about what was going on at home, whether there was safety at home, what kind of financial resources they had to get medication. And I saw that that was an opportunity for me to have a job where I actually was able to take care of people and feel like I could go home happy and fulfilled when I finished work. And so that kind of redirected my life and pushed me towards medical school. So I'm definitely grateful for that opportunity, although I'm still disappointed that I wasn't talented enough to achieve my original dream.
Oh man, I'm so glad you're in medicine. Thank you so much. Tropikana, I think we're going to have to turn it over to Renee. We only have a minute left.
Thank you, gentlemen.
So Renee, take it away. Renee Mahaffey Harris, President and CEO of the Center for Closing the Health Gap.
Well, first of all, thank you to both of our moderators. And Dr. Crawford, thank you for contacting us. We definitely need to have you back. We've begun a conversation that is an important conversation in our community. I think COVID-19 has really kind of ripped the veil off of many issues. Before I kind of make one closing statement and not get someone calling me saying, well, it's 5 o'clock. I want to thank our partners that made this happen. Back in March, we came together with the Urban League of Greater Cincinnati with Eddie Cohen, with the African American Chamber, with Eric Kearney, with Joe Mallory, with NAACP, with Dr. Roosevelt Walker, and now Dr. Shomo with Cincinnati Medical Association, and our Councilmember Jan-Michele Kearney, to say, what are we going to do to make sure we get information to our community? And so I applaud all of our partners for our continued work to work together to make sure that we have trusted information, and what you have each shared today, and this issue and understanding that, you've all given different stories of maybe you might have been a musician or you might have been a basketball player or what have you, but you chose medicine and you have talked about the importance, and I think we have to keep having these conversations. So I am so grateful to each of you, Dr. Duplechan, Dr. Williams, Dr. Thomas, Dr. Henderson, Dr. Cole, and of course, Dr. Crawford. Thank you for joining us today. We look forward to seeing everyone in 2 weeks, and keep masking up, washing your hands, and social distance, and get the vaccine when it's your turn. Thank you.
Black men in medicine. Woo-hoo.
That's right.
Thank you. Thanks, everybody.
Thank you all. Thank you so much.